Hello, everybody, and welcome to this week's COVID-19 virtual town hall. I want to thank everybody for joining us. If you are joining us live, you are more than welcome to ask questions as we go in the chat section of our stream, as well as sending questions via the COVID-19 questions at chw.coos.or.us email that is located right below Barb Young, our American Sign Language translator. Today we're also joined again by Brian Leon, our epidemiologist, and Steve Takis, the battalion chief over at Coos Bay Fire. So we have some questions that have been sent via email, and I'm sure we will get some sent through our chat, hopefully. We are going to get started. Brian, do we just want to go straight to questions, or do you want to give a little synopsis of what has changed over the last 7 days? What do you want to do?
There may be some audio concerns.
Already? It looks as though it's picking up. All right, hold on. Let's try and turn it up. How about that?
I guess we'll find out.
You know, if we don't have an audio concern, at one point during one of these, I might not know what to do with myself.
Yeah, so since last Tuesday, quite a bit has happened. Our cluster of COVID-19 cases coming from the Shutter Creek Correctional Institution has expanded to a degree. We now have a total of 15 cases in Coos County, all of them with a connection to Shutter Creek. 2 of those individuals are employees, and of course we have been handling contact tracing and all of the aspects of controlling the spread of illness, and that process has been very, very smooth. So I'm very encouraged about where we stand there. Yeah, I guess that's kind of the summary of that situation as it stands right now, as far as just basic cases.
All right. I know that that's a hot topic. A lot of the questions that we received in our email had something to do with Shutter Creek in the situation. I have one question here. It says that I'm hearing that Bay Area Cancer Center and Bay Area Hospital don't have enough PPE. And then really just they want to know if that's the case in a lot of the hospitals. Do we know what the PPE situation is? And I know that we, from as far as Coos Health and Wellness goes, have been trying to work very closely with our hospitals and medical centers to ensure that the PPE that we receive are distributed equitably. Mm-hmm.
Probably what I would address that there may be a couple of different issues at play if we can perhaps get a little bit of a better understanding of the question. But
well, why hasn't the governor provided PPE to the Oregon hospitals? So there is PPE that is coming from
right,
the state.
Some of that is coming from the state, yes. So personal protective equipment right now, there would be a couple different categories that I would assign that to. Number one would be the equipment that healthcare providers need in order to perform their duties in care, and so what equipment is indicated for that particular purpose. Mm-hmm. There is also the additional equipment, or maybe more of the additional scenarios that perhaps is not necessarily medically indicated, but maybe falls under that category of, hey, everybody should be wearing masks when possible, regardless of the scenario when you're out in public. So I do know that I believe for standard of care medical application that currently they have enough PPE for scenarios such as like the cancer center where there may not really be any indication that there is a suspect COVID-19 case, or the procedures that are being done may not necessarily be procedures that we would worry about having full protective gear on, but maybe, back to that whole idea of, hey, when we're out in public, we probably should be wearing masks type recommendation that came from the CDC earlier this month. That may be a different scenario, and I know that we and a variety of agencies are attempting to make sure that masks are available, whether it be cloth masks or other potential sources of masks.
Sure. And Steve, from your guys' standpoint, like how do you feel about PPE is from a first responder perspective?
Yeah, as a first responder, our agency specifically, I think that we are doing pretty good, and some of that does come back to what the county health department has done with working with the state and other agencies to bring PPE into our community, and just kind of communicating with some of the other first response agencies throughout the county. I think that we're in a pretty good position. And again, I mean, some of that is coming from Coos Health and Wellness, the county health department here, and I don't believe that they would be giving it to us if they didn't have any for the hospitals and clinics and everything as well. So I think that we're sitting pretty good.
Yeah, I do know that our liaison has a worksheet to how to distribute amongst all of the organizations in an equitable fashion so that everybody's got what they need to do the next thing. And I know that that's going to be of the utmost importance as certain things start to open throughout the community.
Right.
Lisa has a question, and this is actually a question I've had myself, and I keep forgetting to ask you. Oregon Health Authority announcements of deaths always include she or he had underlying medical conditions. What specifically are considered underlying medical conditions?
Good question.
You never seem to die from COVID-19. You die from some complication from something else, right?
I definitely would say, in terms of cause of death and death certificates and things like that, there's always been a little bit of attention in trying to describe what was a contributing factor and what was the actual in that moment caused someone to pass. So that's all. COVID-19 does not bring anything new in that regard. That's always been a little bit of a struggle. But to answer the main question, it is certainly a situation where we're looking at two main systems: cardiovascular system and the respiratory system. So people with hypertension, people with underlying respiratory conditions, such as COPD, other conditions from those systems, as usually a chronic condition that is consistently causing quality of life issues for those patients anyway. There's also something to be said for the urinary system, as far as kidney function and things like that could also end up contributing to complications from COVID-19. So when we say underlying health conditions, we are typically talking about the first two and then potentially the third system, as far as chronic conditions, making it more difficult for the body to be able to react and fight COVID-19 infections as much as we would like them to be able to. So it's a variety of conditions under that umbrella.
Awesome, thank you. Monica asked, we were wondering if it's currently legal for vacation rentals to be rented to non-essential workers. And I know that as of right now, at this moment into which we answer this question, short-term rentals are still closed.
And that is something that was enacted both on a county level, and some of the individual municipalities also did something similar to that. Now, vacation rentals, again, that is specifically a short-term rental situation. I'm not exactly sure of the number of days. I don't have that in front of me, but so I am aware of some folks that have those kind of rentals that elected to go ahead and try to rent some of their properties on a longer term basis, which is fine. And then, of course, that situation is changing. As of right now, I believe the commissioners are going forward with a plan to let the county-wide short-term ban on lodging expire at the end of this month, which is right around the corner. And then some of the individual municipalities are also considering a similar lift of that ban.
So stay tuned. Man, I had something to say and I forgot what it was. Rick has a question, said, I'd like to know if any prisoners have been released since the first case at Shutter Creek and if they were tested prior to release.
Yes, there have been adults who were in custody at Shutter Creek that have been released. They were not necessarily tested before they were released due to the fact that there would be a little bit of a different process if individuals were showing symptoms at that stage. Right now, we're still kind of in a situation where there doesn't appear to be a lot of benefit to testing asymptomatic individuals. So we've essentially just been working to try to communicate with individuals that are being released. They're not necessarily being released to Coos County. They may be released, anywhere in the state. And so we're just trying to track those as much as possible, make contact with them, just as if any other confirmed case that we were to come across, we would want to make sure that we were in touch with their close contacts and make sure that line of communication is open so that we can talk about their symptoms and what their expectations are, make sure they have the ability to isolate, things of that nature. So the release of individuals, I don't necessarily think can be avoided, once someone has finished serving their sentence, then there's an obligation to let them go.
Yep. Piggybacking kind of, we breached the topic of the non-symptomatic testing, right? Mm-hmm. Brenda was wondering if there is a plan in place yet to do the testing of non-symptomatic healthcare workers based on their possibility of exposure. They know, she said that we know if someone is symptomatic, the protocol is to contact the PCP to see if testing is required, but wanted to see if tests are available yet for non-symptomatic employees, and if so, what's the process or projected date? And I know that that's come up quite a bit, mm-hmm. Especially surrounding the Shutter Creek
mm-hmm.
Situation.
Yeah, so some of the most recent guidance that the Oregon Health Authority has released in regards to testing criteria was updated last week on April 20th. And that did include the fact that, some clinicians may go forward with the potential testing of someone that's asymptomatic, particularly when they are living in a congregate setting, such as corrections, such as long-term care facilities, depending on what's going on there. So it's not necessarily a situation where we would just say, yes, everybody should be tested, but for clinicians to be able to look at that on a case-by-case basis. So that is something that has already happened to a degree. But it would still be a decision right now between that employee and their provider, based on that individual's full history, context, exposures, and a variety of other factors. So that's a decision between the provider and the employee to go forward with a potentially asymptomatic test. Again, part of navigating that and trying to answer that question is the fact that we do know that an individual that is tested while they are not showing symptoms, even if they are infected, there is just simply a lower likelihood that they are going to test positive, or in other words, a higher chance that they are going to show a false negative. And there are a lot of aspects to that have their own pitfalls, including providing a false sense of security, including, okay, if someone is going to continue being exposed based on their profession, do we test them every day? Do we test them every week? Because just because someone tests negative today doesn't mean they won't test positive tomorrow with either stronger symptoms or an additional exposure. So that is, we certainly understand why there is a desire to get as many people tested as possible. But if you're saying this person is exposed because they work at this facility, that is simply not a simple answer to making everyone feel better. It's just a tough situation all around. We understand why there are questions in the community about that. It's just there's not a simple resolution is essentially what I'm coming down to. So
how do you feel about that one?
Yeah, so Kathy has a question from live chat about whether or not the first case at Coos County was from the jail. I'm going to assume she's talking about Shutter Creek institutional facility.
I would imagine so.
We are aware of the fact that the first case that was identified here in Coos County had at one point been at the correctional facility at San Am up in the Salem area, but there was a pretty significant time lapse between when they were transferred and when that individual started showing symptoms, or at least reported symptoms. So I would not say unequivocally that this gentleman was infected at San Am and then came down and eventually developed disease. I hope that answers that question.
She has a follow-up question.
Okay. Yeah, I'd be happy to chat about this. Gives me a chance to brag about my team. So we do have 15 cases. They are all associated with Shutter Creek Correctional Institution at this time. Like I said, there are 13 adults in custody that were identified, tested positive. And there are 2 employees at that facility that have tested positive. Now, as far as our contacts being traced, after the very first case, my team essentially was able to make contact with nearly 100 employees and have interviews with them, be able to, they were able to get a really good understanding of what their additional contacts were outside of the facility, and to just kind of get an idea, how many people are in their household, what places in public have they been, and to really just come away with a really, really good overall picture of each one of those employees, and to make sure that if there were to be additional positive cases that did hit staff, that we would have a really, really good just situational awareness about what needed to happen from there. And at the time, there were very, very few people with even minimal symptoms that could be demonstrated as a possible COVID-19 case. And we were able to have just really develop a rapport with the employees and just keep that line of communication open. So as more adults in custody tested positive as time went on, we spent time last week making second contacts with those individuals, making sure that the situational awareness we had developed the previous week was basically unchanged, and to continue to keep that line of communication open, talking to them about testing and so forth. So when the first case was positive for an employee on Saturday, we were already very intimately familiar with their situation and what their contacts were and what the potential exposures had been. And the same for the individual that tested positive yesterday. What day is this?
Tuesday.
Okay.
Yes, hard to tell anymore.
So contact tracing has been well in hand. It has served us very, very well. A lot of the work that we've been able to do, because we haven't had very many cases outside of the facility, has really, really paid off in that regard. Once we got the most recent case identified, we literally had everything nailed down as far as what needed to be done and what info needed to be updated within 60 minutes of that phone call and being told that there was another case. So in terms of the control of the spread and that these employees could potentially represent in a normal situation because they are outside of the facility, we feel really, really good about where we're sitting there.
Just ask about the abiding by quarantine piece as well.
So positive cases have been, first of all, none of them had needed to get acute medical care, and that is true of the two employees as well. So far, they have been able to basically remain isolated, staying at home, taking care of themselves, limiting the amount of potential exposures. So that's been great.
I'm gonna. Oh man,
How long of a lockdown would it take for those cleaning?
I don't really understand that question.
Yeah, I'm not following it either.
I'm gonna pop off from the live piece here and ask one of these emailed questions. I've got one thing I do want to address that was in a question, and then one question I do want to ask. Jerry had asked if we can tell her if there are any cases in Coos Bay or Coquille, and one thing we will never do is, I don't think, narrow it down to a city. I think we can tell you this is how many cases we have in Coos County.
Mm-hmm.
But to narrow it down to specific cities, because our populations aren't very big, that would be problematic from possibly for anybody, right?
Yeah, so I mean, we understand that this is COVID-19 is a very serious public health issue, and a lot of people are concerned. And of course, we've done so many things as a community to be able to mitigate that. And I definitely understand everyone's concerns, but at the end of the day, these are medical issues. Everyone has a right to medical privacy, and we are always concerned in epidemiology that there is a tension between providing up-to-date, accurate information and transparency and respecting the privacy of individuals that are ill. So we, our population as a whole can be very small if we start narrowing it down to individual towns in our county in some cases. And we're very concerned about the fact that there have been employees that have not been treated very well just because they work at Shutter Creek and the situation that we're in right now.
Shirley has a question.
Mm-hmm.
I'm an employer with an employee needed to travel out of state via airplane. I want to require her to be tested before returning to work after a 2-week self-quarantine to assure she is not a carrier and asymptomatic. I understand testing is greatly limited. Would there be any consideration given to a workplace policy requiring the test in order to return to a job not able to perform from home?
Well, Shirley, thank you for asking. Unfortunately, I think there are several concerns that I have about what you just shared. First of all, without knowing some more specifics in terms of particularly where this individual would be going and how endemic the transmission is in that area, but just the general idea of getting on a plane and traveling back should not necessitate any type of mandated quarantine or testing, particularly if someone is not symptomatic, unless we have more information about exposures that the individual may have been exposed to, then we would not really be able to recommend anything other than the individual practice symptom monitoring, making sure they're checking for fevers maybe a couple of times a day, being very, very aware of what their body is telling them in terms of other potential symptoms. One thing that's been consistent from day one has been we recommend that if you're ill, you stay home. And so that doesn't change, but someone that is not showing the symptoms should not be excluded from work, except for the situation where we are confirming them as a close contact of a confirmed case. So I hope that clears that up. And really, I'm just going to go ahead and take this a step further. Because of the Shutter Creek situation, we have been getting some inquiries about second degree contacts of those that work at Shutter Creek. We have already heard stories about spouses or adult children that happen to live in the same house of employees that have been excluded. That includes an employee that seemed to have lost daycare for their child. And I just want to say unequivocally that is 100% inappropriate. Again, if there is a confirmed case or someone that is being tested with a symptom profile, we can take a look at their close contacts, especially their household contacts. But excluding a spouse from work because they happen to be married to somebody who works at Shutter Creek is, first of all, just simply not scientifically sound. Second of all, inappropriate. These are individuals that work in our community. They pay taxes just like all of us. They contribute to our community like all of us. They are in a situation right now that can be very frightening for them based on what is happening, and it is just simply not okay to treat them like people that are to be avoided at all costs, or their family members to be avoided at all costs. It's just simply not appropriate.
They're not records. They're your neighbors, they're your friends, they're your aunts, your uncles, your brothers, your sisters. They're your neighbors, and we need to remember that they have a job that they are doing in very rough circumstances, and those family members and themselves shouldn't be treated like lesser because of it. Which kind of rolls into Kathy's other question about quarantining for all positive cases in their contacts. It seems inconsiderate that people positive or in contact with positive might be running around town. Kind of lays right into that, I think, to a degree, as far as some of the things that you pointed out.
Right.
Judy sent me an email, and we've answered most of it, but she had a couple questions, and I just want to reiterate this for everybody that might be listening. You are more than welcome to ask questions live, as we have seen tonight, and I want to thank everybody so far that's asked questions. These have all been really good. And she asked, will the Corrections Department attend one of our town halls so that we can ask them questions directly? They had been invited to participate in a town hall, and they had declined due to some other issues they couldn't participate in currently. They have said that once some of those other things clear up, that they may join us. So we do want to give you the opportunity to ask the people you have the most questions for the opportunity to answer them. So we're still going to keep working on that, Judy. I hope that answers your question. How long until people who have been waiting for their surgeries until they can proceed safely is the financial impact to hospitals and small businesses being taken into account? I do know that as of right now, the plan is May 1st, right? That they can start doing elective surgeries. That was the tentative date that had been tossed around. I don't know if that has been solidified.
based on recent communications, I think that is still something that they're trying to hammer out,
Is
at
it still up in the
least
air?
in terms of Bay Area hospital. So we should probably refer that.
That should probably, yeah,
question to them.
ask your provider probably.
I believe the restriction at the state level has been loosened a little to allow that to begin again May 1st, but it's still going to be up to the local hospital or clinic or whatever to make those decisions if they can still do that safely with whatever the local situation is.
I
Right.
do know that I got a text message. that orthodontics is going to start opening again later.
Okay.
I think they've started to look forward as to, we have the possibility to do these things and we can start scheduling some things. So I would imagine if you were an individual looking to have one of those surgeries, that you should be probably hearing something from your providers if that was the case, I would
Right.
imagine. We can't necessarily pinpoint whether or not they will, but.
Right.
What do we have? Sterling. Antibodies testing that is going on at Coquille. Why would we need to get tested if we haven't gotten COVID-19? That's actually, I think, a gateway to talk about. Do you have any information on the testing in Coquille?
Yeah. So some of the antibodies testing that is being done, particularly, I know a little bit more about the one test that's being done at Coquille Valley Hospital. That test is actually very, very interesting because, first of all, it should be very, very clear this test is not used to determine a current or recent infection like we would do other tests in order to tell us whether or not this is a new case of COVID-19.
Right.
There are certainly reasons why someone may test positive if they were not infected with COVID-19,
Mm-hmm.
although that seems to be a relatively low chance. The developer of that test did admit that it was possible for previous versions of coronavirus to cause that test to be positive. And so what that really means is, because of all of our exposures to different infectious diseases often have a lot to do with how old we are. The older we are, the more likely we'll have come across a variety of different cold viruses and other illnesses. And so if someone's older, the older they get, the more likely that they were to have been exposed to those other coronavirus versions. And so there is a little bit of a chance that someone could test positive for that. And then there is, of course, a chance that someone could test negative when they actually had been exposed. One of the concerns also is, okay, if it's positive, and let's just say it's correct, what does this mean? Does it mean I have immunity? Does it mean I can't get COVID-19? And if so, how long? Those are questions we simply don't have the answer to. There's still a lot of debate about whether or not there have been a decent amount of examples of reinfection after someone has had COVID-19, recovered, tested negative, become ill again later, and then tested positive for COVID-19. That is not something I think that's happened here in the US. I could be wrong, but some of the countries where this illness was endemic well before it became an issue here in the States. So
we won't really have a good grasp on that until later.
Right.
One thing, and I don't know if you can actually, if you can clarify it or not. Now, when you say other forms of COVID, you don't mean
other
like COVID 1 through 18 or coronavirus.
Okay.
You don't mean like COVID 1 through 18, because that's not the thing. You're talking, there are other versions of a coronavirus, right?
Mm-hmm.
Okay.
So, for example, the one that I think most people are probably familiar with is SARS,
Right.
the one that started back in 2002. That, if you're old enough to remember, was also a little bit of a scare. The Middle Eastern Respiratory Syndrome, I think MERS. That was something that I think that came out around 2012. I could be wrong there. But there was also a lot of somewhat humorous chatter about when we were dealing with coronavirus coming to the United States was, oh, it's not really that big of a deal. It's not much more than a cold. There have been coronaviruses that have not been much more serious than a cold. And in fact, one of the individual patients that has had that recently kind of came across, and it kind of caused a little bit of a stir before we got our first case, and we ended up figuring out that it was a previous version of coronavirus that we'd seen in their medical records. So I hope that answers your question.
I like how you said if you're old enough to remember SARS, and you said it's 2012. For the 8-year-olds that are listening, or 2002, you said 2012.
That was the Middle Eastern one. But.
So I was going to say, if you're 8 and you're watching our video, our virtual town hall, then you might not know that.
Thanks. Thanks, Mr. Sassy Pants. I appreciate that.
That's good, though. I think it's good to understand that this isn't like the first coronavirus, and that antibodies testing, if you were exposed to any of those other things, could still pop, right?
Yes.
Do we know what did you say? You said a lot. Did you say what the plan would be, like if you go and get that test, what you expect to do with the information?
So that data is being shared with us, and I think at some point when we can kind of match up with who was tested for COVID-19 with the more traditional diagnostic PCR test, if we detect there was the potential a lot of different people tested positive and either never got tested, or maybe they were tested and they tested negative. That would certainly be valuable information that we would be able to use. If there's just a handful of positives, then we have to consider the issue we were just talking about, maybe quote unquote false positives if we're talking about COVID-19. And then of course, if there's just basically mostly negatives, then maybe it reinforces the idea that we did actually have a pretty accurate idea of what was happening with cases, even with the challenges to testing.
Melissa asked if we could just give a quick shout out, and I think that this is actually pretty warranted. Today, apparently, Domino's has announced, the local Domino's in Coos Bay has announced today that pizzas are free to all Shutters Creek staff that show their badge to Domino's, and I think that's a heck of a sentiment.
Phenomenal.
That is a heck of a sentiment. Phenomenal. You were so excited you forgot how to speak. That was, I think it's great that a community partner is willing to try to do what they can to help these staff members. That's awesome. I want to thank you, Melissa, for bringing that up.
That's definitely one positive light out of all of this is I think you can find stories like that just about every day of different community groups helping each other and things like that. If you get on social media and you see different groups supporting local businesses and things like that, encouraging people to do the same, I think that's one bright light out of all of this.
Rick has a question. We'll come back to that one up there. Rick has a question. It seems you could diagnostically test all people connected to Shutter Creek. It would go a long way in calming the fears of the community. Is it a lack of test availability that's holding testing back?
So I'm going to reiterate what I said a little bit ago in the fact that testing individuals who do not have symptoms is problematic. We've one of the things we do feel really, really confident about amongst a lot of questions still at this stage is the fact that someone that does not have symptoms, even if infected, are much less likely to test positive because of the sensitivity of the test. So, and I would also add to that that testing and screening is a scientific process, and public relations is not. So trying to use a scientific tool to ease public concerns is probably not appropriate. It would almost be a little deceitful in that case if we knew that this doesn't really help us with information about whether or not someone is infected or will continue to be infected or not infected as they have continuous exposure. But just doing it for the sake of doing it just simply isn't helpful.
I see what you did there. Why quarantine the well when we have the same outcome of flattening in states or countries have it where some lock down and some don't? Why not push herd immunity? It's scientific.
So I'm gonna assume that by herd immunity you're talking about without the convenience of a vaccine. I'm assuming we're talking about trying to strategically make sure enough people get infected to protect those maybe that are a little bit more high risk. This is a very, very serious illness. We only have so much capacity at our healthcare centers to be able to handle COVID-19 patients. I think strategically being okay with a large percentage of our community being infected is questionable at best.
So like from a herd immunity standpoint, you mentioned without the convenience of a vaccine, the fact that everybody or the vast majority of people are vaccinated for, like, let's say polio,
right,
is what causes the overall herd immunity,
right,
to that specific thing, but we don't have that
right
ability for COVID-19, nor do we know when that is going to be available, right?
Right. Correct. There are a lot of organizations globally that are working on a vaccine, and that process does take a pretty good amount of time, but that would certainly be an option. But yeah, trying to kind of develop human shields against the infection without such a vaccine would be morally questionable.
Ill-advised. For sure. I just can't get over the Domino's thing. That's pretty awesome.
It's very awesome.
I like it when community comes together, and I think, Steve, you made a good point that there's so many groups that are doing things, like the groups that got together to sew hundreds of masks,
yeah.
and the Area Agency on Aging and their call line that if you are of the vulnerable population that can't leave your house and you need help,
Mm-hmm.
that you can call their hotline, which is also part of the community COVID-19 hotline, 541-266-1650, that you can get into that line, and they will help get you the things you need. I mean, the fact that our community comes together to do the things that we do to help those that can't help themselves, it's pretty amazing to sit back and just kind of watch all of us come together to do that. And it's sad to see the other side of that coin, as we have with Shutter Creek staff, but I think we're hopefully moving in the right direction.
Could you say that phone number again, please?
Yeah, the phone number again for the community COVID-19 hotline is 541-266-1650. Yeah, thank you. We have 15 more minutes. If anybody else has any questions, we would love to. Oh, I got one inside an email. Hold on. Nope. Someone's trying to ask a question, but it's not actually showing up. It's just a blank email. So, still nothing. This is oops error.
Case 911, Trailer Medical.
Maybe they just need to send me. Okay. Anything else that we can think of that we might want to inform the community on based on new information? I can't.
Steve hasn't gotten much of a chance.
I know.
We got some info for us now.
We need some first responder info. We had such a good time with our first responder one. We have to dole out Steve's knowledge slowly. He's
Sorry, I was listening to the radio. I really don't have a lot to add. I think that last week the town hall, I thought that was good. There was some good questions. I hope that people understand that we're still here to help. We're wanting to do everything we can to help keep the community safe. And it's not just first responders. It's the health department here. It's the workers at the clinics. It's the workers at the hospital. All the different people that are here trying to keep everything moving in a good direction and get us all through this.
Thank you, Kathy. Good quality video. Look at that. Eventually, we're going to get this whole thing squared away. This going to YouTube seems to have helped as far as the streaming has gone.
Sure.
No, Steve, you're right. I think we really, and I know it's a cheesy statement and it's been said probably 100 times in 100 different places, but we really are all in this together. I mean, this is a community response, especially from the community partner standpoint, but it also has become a community response from the non-essential worker, piece, like all of the volunteerism that's been happening and the support for the community through various actions. Again, dominoes, the masks that have been made by so many groups. It really has been something to see as far as that goes. Melissa has a question. I don't know. You might know the answer to this. So if we were to give people plasma of those that have recovered, can that make us immune to COVID?
Yes, this goes back a little bit to what we were talking about in the antibodies test. We're not sure how long those antibodies last and to what level they are needed to confer immunity. So I'm sure that's part of what may be being researched and studied by those that are trying to handle the creation of vaccines. But at this stage, we don't know even if we detect antibodies, whether or not they'll offer immunity, and if we and for how long. So that's a part of the problem with a new virus. There's just not a lot of time that we can look back and observe things yet.
Right, and I mean it's important to reiterate there is no vaccine for this at this point. There is no cure. You cannot and do not and should not ingest household cleaners to try to do such. There's been some very serious injuries in the United States because of that. Please use and utilize the prevention steps that have been shared since the beginning of this. Like washing your hands, covering your cough, disinfecting your workspace or where you use hand sanitizer if you can't get to soap and water. Be mindful of those precautions. That is really the best way to keep yourself safe at this point, and continue following the guidance that has been set forth by those that know more things than we do.
Yep. If you're going to wear a mask, having it below your nose or across your neck or hanging down to one side, probably not super helpful.
Right. And that's because the stuff on the outside of the mask, right? For the people that don't truly get why that is, it's for the stuff you've actually come in contact with.
Right.
So if you put it down there, you're actually then just sniffing it right off the front of your mask.
Yep.
Debbie has a question. What's the current turnaround time for testing, and where is testing lab located for Coos County?
So in terms of actually performing tests in-house, there's not many laboratories that are doing that right now in the county. Most providers would be, we've basically been talking, if you have a primary care provider, that's your go-to for getting tested, and that's whether, regardless of whether you go to a clinic or maybe you go to North Bend Medical Center. If you don't have a provider, that's one of the points of the hotline. to kind of route you to some options if you do not have a primary care provider. But I believe there may be one or two facilities that are doing a similar test, at least to get going, as far as leading to a potential diagnosis, not the antibodies testing, that are here in the county, but that is not something that public health is directly involved in. So the best bet is to start with your provider. If you don't have one, call the community hotline we discussed earlier and go from there.
Perfect. Michael has a question. If Shutter Creek isn't socially distancing, why are they still able to operate?
So social distancing in the context of a correctional facility has been doing things that will limit the amount of people that are coming into contact with each other, and that's why it was decided across all institutions to limit visitors, even though that's obviously usually a really important part of being in one of those facilities, is the importance of visitors. But so limiting the amount of people that are coming in and out of the building, limiting other aspects of just life inside the facility. Like, for example, they do have just groups of people that don't mingle much with each other. As far as why they are allowed to continue to operate, if things like their bed situation does not provide the ability to have 6 foot social distance, or the eating area may not have the ability to provide 6 feet social distance, the solution is not very clear for what could resolve that issue. And so that would probably be, in terms of why they're allowed to operate, that's probably not a question for us.
Well, but I think on a larger scale, if you think outside of Shutter Creek, right? Mm-hmm. Shutter Creek is the hot topic right now. It's the fire in people's eye because it's close, and it's a problem right now for us. But if you think about it from, like, say, the Navy, okay?
Yeah.
If you have a 505 foot destroyer that is got 315 men and women, you are never at any point more than 6 feet away from anybody, right? Because there's no possible way to social distance properly in some situations that still have to remain operational. Mm-hmm. And yes, Shutter Creek isn't the military, right? Shutter Creek isn't a naval vessel, but some things still have to operate, even though in the absence of the ability to properly utilize the 6 foot social distancing. And you have to kind of just adapt and improvise to the situation based on your surroundings, right?
Right.
I mean, is that fair to say?
Yes. Yeah, I think that's very fair to say. And from a policy standpoint, way above our level,
right? For sure.
They have to kind of hash those issues out. Our leadership has to figure those things out and balance a lot of competing factors.
Well, and some of the guidance that has come out for some of these more critical services, so, Shutters Creek, I would say, is one, hospitals, my job, like, we don't always have that ability when we're trying to provide a service to keep that 6 foot distance from either the people we're trying to help or the people we're working next to. But because of that, there's also been guidance from CDC and trickled down through OHA for us to screen ourselves better and do some of those other things. Mm-hmm. So we acknowledge that there is a little bit of risk with that, but we're also taking extra measures on the other side to try and mitigate that risk as much as possible.
Right, absolutely. So Lewis has a question: is my concern valid that these governmental bodies are making decisions to open up for tourism while our county is increasing the number of positive COVID-19 cases based on business interests and not on community health?
There certainly is a tension between some of these competing interests. Obviously, COVID-19 is a health issue, but obviously it also impacts a lot of other aspects of our society. So we are going to have to trust leadership to balance those priorities as much as possible. I'll say what I've said several times before in the past, that we do not want to feel like a lot of the sacrifice that has been made up to this point is in vain because we quote unquote reopen too soon and end up causing a wave of infection that basically puts us where we would have been without these measures maybe a month or two months ago. I share your concerns.
I think it's safe to say that a lot of these places, I mean, you look at Georgia and Alaska and Texas and Florida and some of the places that have opened up, already to bowling alleys and gyms and barbershops, that there's a lot of choices that have to be made. And I know that an economic, forecasts are something that are important to a lot of people and wanting to get their jobs back, and that is understandable. And we hope that the public health divisions and departments throughout the United States are helping inform the decisions that their legislature is making and their leadership are making, so that they make the most informed decision possible. What is the question here? Where can average citizens in our community gain access to masks to wear in public?
I know if you don't have, a store-bought mask or even one of the sewn ones, there are some things online. CDC, I believe, even has some recommendations on how you can make a mask out of a t-shirt, how you can make a mask out of just simple household items. And that's what is being recommended for, the normal citizen out, doing their shopping or whatever they need to do out in the community.
Well, and I know that the governor has specific frameworks for reopening Oregon, and one of the public health frameworks, actually number 2 on the list. I mean, number 1 is that we have a declining growth rate of active cases, but number 2 is sufficient personal protective equipment. And I don't think that necessarily means just for healthcare. That means, I think, for community-wide. And I know that's a question that is going to be coming up, and that's a question that we're going to have to answer, and we're going to have to think very creatively on how to ensure that there is at least access for people that want to go into the grocery store, the barbershop, the bowling alley. It's a good question, and hopefully we have a more robust answer in the coming weeks. We have a couple minutes left. I want to thank everybody that has asked questions tonight. I want to thank Steve, as always, for taking time out of your very busy day to come and help and support us in our efforts to engage the community and give them the most up-to-date information. Brian, as always, it's a pleasure to have you and your breadth of knowledge to help support everybody in our community. You're doing a wonderful job. But we would be nothing if we did not have Barb Young at the ASL translator camera over there. She does a wonderful job, and I'm sure she loves signing her own compliments. I'm sure that makes her feel good. Thank you so much for taking the time to come here every week and do these things for us, and I really hope that it is beneficial to those out there that utilize ASL. Next week, same time, same YouTube channel, we will be reconvening to have more conversations about what's new in Coos County and the COVID-19 landscape. If you have any questions, please don't hesitate to send them to the email address at the bottom of your screen. I'm not going to make Barb sign that again. Until then, stay well, stay safe, and hopefully we get to talk to you soon. Have a great night and great rest of your week. Goodbye, everybody.